Dry mouth, that could cause serious issues with the health of your teeth as well. Here to explain some causes and how to address dry mouth, please welcome back cosmetic and family dentist, Dr. Terri Alani. Hi, Dr. Alani. Before we get into that, I can smell Jared's fresh, minty breath right over here. I can smell it from over here. All right, so do you normally brush for like 2 minutes?
Yes, ma'am.
You do? So this is nothing new to you?
No, ma'am.
Okay, so I think a lot of people think 2 minutes is kind of a long time, don't you? Yeah, and we haven't really timed it, but as she mentioned, 2 minutes is what's necessary to get a good brush in.
Good for you.
All right. Dry mouth is a common problem, but a lot of times people look at it as an inconvenience, but it's much more than that.
Yeah, there's a few statistics. More than half of Americans more than half of Americans take at least one prescription drug daily, okay, or a pill daily. And so basically it's become more of an older disease, even though it can afflict younger patients. Patients 65 or older, 90% of them take more than one pill daily.
Yeah. And a lot of medications can affect
exactly.
Cause dry
the
mouth.
#1 cause of dry mouth is medications. And what patients aren't aware of is that when you do go to your dentist, to let us know the list of medications that you're taking so we can at least help you.
Yeah, because when you have a dry mouth, saliva's there for a reason. It's a good,
exactly.
We have a perfect machine here, but so when it dries up, there's some issues.
Right. The average person, a healthy person, produces 1.5 liters of saliva a day.
Ooh, did you measure that?
Yes. And basically what saliva does is it's produced with the salivary glands, which are in our mouth, and what it does is actually is a mineral-rich solution that sort of washes away all the bacteria and all the plaque and everything in your mouth. So if you have a restriction of salivary flow, which can be caused from these medications, basically you're very susceptible to decay. You're susceptible to inflammation, because what happens is the dryness actually irritates your soft tissue, which can cause inflammation, which can lead to infection. And you can get ill-fitting. It causes dentures to be ill-fitting. It can also cause your tongue to be very dry or whatever, red. And it can create cracks on the sides of your mouth, leading also to infection.
Okay, so we talked about medications. What kind of medications in particular?
Okay, there's many medications. There's over 500 medications that cause dry mouth, and of the top 10 medications, 80% of those cause dry mouth. So let's talk with high blood pressure medicine. Mainly your alpha blockers and your beta blockers aren't going to be a culprit, but diuretics. Diuretics are the #1 cause of dry mouth if you're taking high blood pressure medication. #2 would be your sinus medications, such as Benadryl,
Yeah, because they try to dry up things
Yes,
anyway.
what they do is they actually affect the central nervous system, the functioning of how they control the salivary gland. So they actually inhibit salivary gland production, causing dry mouth. Another one would be, actually aging can cause dry mouth, except not as much as you would think. Depression can cause dry mouth.
Wow.
Other things that can cause dry mouth would be any type of consumption of alcohol, cigarettes, things like that.
Yeah, they're like, oh, wait a minute now. Okay, so signs of dry mouth, obviously, trouble eating, speaking, and chewing.
Right, exactly. If you have a dry mouth, you're really going to notice that you have trouble swallowing, tasting, chewing, because that saliva helps everything just flow a lot easier.
Right. Now, those sound a little more obvious, but then the burning sensations of the tongue.
Right. You can get burning sensations of your tongue. You can have a sticky feeling in your mouth. Frequent thirst, bad breath is one of another issue of dry mouth.
The saliva's not there to...
And you can actually have hoarseness, sore throat, and actually dry nasal passages.
Okay, so how do we relieve it? I would think that people would be thirsty a lot.
Exactly. Okay, for dry mouth, what we recommend, first of all, always carry a list of medications to your dentist, because we can actually talk to your pharmacist and to you as the patient and try to figure out maybe an alternative medication that could help. There's also other things that you can get over the counter. There is Biotine, which is an over-counter sort of oral stimulant that can help secrete saliva. And you have other products that can actually get at the dentist. For some patients, we recommend fluoride trays, where we actually take a tray like a whitening tray and you can put fluoride in it, and that will help keep your teeth healthy and keep it decay-free. Sugarless gum is always great. I recommend that. A humidifier. And a humidifier will actually increase the air circulation in the room. People don't think about that.
Yeah.
Sucking on ice chips but don't chew ice. Ice will crack your teeth. Just sucking on ice chips.
Even that soft shaved ice.
Right, and increase your fluid intake. Now, something else I want to bring up very quickly is for those people that actually have lost teeth or they have dentures that don't fit correctly, when you restrict your chewing, you're actually shrinking your salivary glands. So you will reduce the amount of saliva. So it's real important that you actually have proper fitting dentures, or you have a place like implants or whatever to restore those missing spaces. That's really important.
Right. Speaking of implants, you have a thing called Invisalign. Okay, Dr. Alani has a special offer right now. Get $200 off. I'm not Invisalign, Snap-on Smile. Snap-on Smile. Now, Snap-on Smile is a really cool thing. This is before and after right here.
There's an actual patient. We changed her life.
What happened is those teeth are actually snapped on top of the existing teeth, and so you have no idea. So it's not like a veneer or anything. You know,
right,
it's a whole different process.
Removable appliance. It's reversible, and it takes 2 visits, and we have changed so many people's lives. It's just incredible.
It's amazing. It literally snaps on, and you have a whole different smile in a matter of seconds. All right, again, Dr. Alani has that special offer. Right now, you can get $200 off Snap-on Smile, which is custom made to fit your mouth. Oh, there's more. Plus, new patients who get an exam, x-rays, and cleaning get $100 toward any procedure with their next appointment. So to take advantage of this, you can call Dr. Alani's office at 713-621-5141, 713-621-5141, or find her on the web at TexasToothLady.com. Also, Dr. Alani co-hosts a radio show with her brother, orthopedic surgeon Dr. Wayne Alani. It's called For Your Health with Terri and Wayne. It's on every Saturday at 9 a.m. on CNN 650 a.m. Thanks for our boot camp lesson.
You're welcome.
All right. When we come back, Sarah Gonzalez was hospitalized for what she thought was a heart attack. Find out what the real culprit